Great. Hi, everyone. Welcome. I'm so glad that you're all here today for the session on integrating mixed data for impact. Hopefully, this will be kind of diving into easy and practical ways to bring together both qualitative and quantitative data to help strengthen your work, especially in public health and tobacco prevention. I'm Nicole Zwick. I'm one of the senior evaluators for the Community Epidemiology Program Evaluation Group, the CPEG. And I'm really passionate about making data useful, not just by collecting it, but actually turning it into things that are insightful that drive change. This is just a reminder, this is a very casual environment, so feel free to be off camera, on camera, come off mute to chat during this. You can snack, eat, whatever. Hopefully it'll have some fun exercises that you can engage you and some visual appealing things to see. At the end, we'll have a time to chat on anything that kind of resonates with you or any questions you have. And then we'll have a second half at 1:30 that kind of talks about the dissemination of mixed data. So today's workshop is really making data feel doable and a bit more fun. We want to clarify those mixed methods to help you feel confident in utilizing various data types. It can to really use in your program designs, it can be in report writing and policy development. So we're going to go ahead and get started with, let's see if I can get my slides to switch. A poll question. We're gonna looking at this as how do you grocery shop? And yes, it will tie back into this webinar, I promise. So think about, do you make a list? Do you browse and then figure out what you want? So we're gonna have a little poll of kind of fun thing to see. Oops, sorry. Navigating the system real quick. And just thinking about how you do this. So we have two questions in here just for a fun thing to like think about. And it's really just like, do you make a list? Maybe you make a quick list. Maybe you don't even go and grocery shopping. So yeah, just let me know what you feel on this one. And then also thinking about, um, how often you go or how you approach it. So this is just a fun way to kind of think about how you do things. Great. We're getting some great polls right now. Uh, Looks like so far the list is making the top one and then a mixture of them. So this is great. Do this for just another minute just to kind of have fun with it. And we'll see, what is the second one looking like? So people are really good at planning ahead and thinking of one big trip at the things. And there's a couple that are doing the multiple short ones. And then there's some people that are sending others. This is great. I really would love to try the delivery service. My daughter has. I have not tried it. So we're going to close this out just to kind of end that fun one. I promise we'll circle back and I'll share those results with you guys. Just have that. So you get to see those results in that. What this is really showing us is how we have a process of looking at things and information, how we like to make decisions. We all have a different way of bringing it, a different way to go to the grocery store. We have a different way of looking at data. And so that's kind of the overall picture. And we're going to jump into, end up sharing this. I'm just navigating real quick. Why does data matter in tobacco? In tobacco prevention and cessation, data isn't just about numbers. It's how we spot patterns and disparities in who uses tobacco and how. It's how we design targeted programs that are actually reachable to the right people. It helps us push the evidence-based policies forward, like smoke-free laws and vaping regulations. It makes sure we really provide those right resources to the communities that need them. So that fuels those advocacy works with really compelling facts that the decision makers can use. So really, data is the anchor that keeps our work effective, grounded, and impactful. So the first thing we're going to do is really dive into just reminding ourselves what quantitative data is. Quantitative is that number-based, it measures stuff, it has those answering our questions like the what and the how many. This data really helps us have that measurable insight to patterns and the trends and the relationships. It helps us quantify the scopes of the issues and track progress and inform our decisions. And on previous webinars, we've discussed really some of those really helpful quantitative data sources that we have available. We have the Healthy Kids Survey, we have BRFIS, that's Behavioral Risk Factor Surveillance System, and the Colorado Health Study, which was formerly the TABS. If you would like more on the quantitative analysis, please check out Dr. Dan Simon's webinar from February. That's on our VAP resource page. It's very helpful. Now we're going to kind of switch gears and do a quick on the qualitative side. So qualitative is that non-numerical information that describes the quality and experiences and perception we're having. It can really provide the content and the deeper understanding of people's thoughts, feelings, behaviors, and motivations. It helps us explore those underlying reasons behind patterns, kind of helping us identify what's going on quantitative data. It can investigate community perceptions, their attitudes, and some of the social context. The qualitative data sources for tobacco work can really vary, so you can be really creative on this. You can think about focus groups with community members. You can think of key informant interviews with policymakers. It can also be open-end survey responses. It can even be your quarterly reporting to STEP. And if you want more information on that, we have some really good webinars on qualitative analysis. And one particular we just did was on using the quarterly reporting that Shannon did. It was really helpful on understanding how you can use that information. So here we're looking at an overall spectrum of how we can integrate qualitative and quantitative data using different kind of perspectives on flowers. The red flowers are quantitative, our yellow are qualitative, and the orange are a mixed method. So on the left, you see the two are totally separate. We're using it for different questions, and there's no overlap. Then on the right, you're seeing that there's this full mixed method research. This study is really that designed to integrate at the beginning of the analysis to the end. And I did want to emphasize that when you're conducting mixed method research, select a mixed method approach that is advisable. It's really a benefit to have some steps that you can use with like a Leach, Dr. Leach and Ogi Boising, I can never pronounce his name, has a 13 steps on how to do mixed method research, and so does Croswell. This would really help you get a comprehensive research design from from the very beginning to the end. And that would be really more for research academic style. I just wanted to note that. But right today, what we're talking about is this middle kind of ground where we all live in the public health practice. We don't need to care if it's a mixed method classification. We really need to know how to use both kinds. So this is where we have that yellow and red flowers. So what we're going to do now is really jump into some practical use of using real data. So we're using running data. Why running data? Well, it's familiar and easy. It helps to visualize. It has both a quantitative and a qualitative element, just like we have in our public health data. So we're going to explore some ways to look at this through each of the lenses. So first, we're going to look at it just as a quantitative data source. We're seeing that we have available. We have dates that people had run, distance covered, time taken, outdoor temperature. So from these, we actually could calculate a constructive variable you see at the end as an average speed per mile. So here, if we're looking at the numbers perspective, we might ask questions on thinking of what is the mileage trend over time? What speed comparison and different weathers do we have? And the average pace per week or month. So one key takeaway we could get from this, if we're looking at the quantitative side of this, is the runner's average speed is 7.1 minute miles with the speeds ranging from 6.4 to 8.1, which is very fast compared to my running. My running is much, much slower. So if we're looking at this through the lens of qualitative data, we're going to be looking at the runner's journal. And in the runner's journals, we can actually put in a thematic analysis or an other qualitative analysis process and come up with some perspective of what's happening. For here, we can actually pull out the routes, we can do weather conditions, the physical health, and the mental health. And when we do that, we can figure out some things like they experience that they're less motivated when they run on a treadmill indoors. And they really do feel happy when they actually get to run outside, particularly on this Hoppy Hill Trail in warm weather. Even though we don't know what warm weather's classification is in temperature, we know that they're classifying it as a warmer weather. So So I wanted to give you guys a chance just to sit here while you're thinking about it, is how would you use this data that you see here on your screen? What kind of questions can you come up with to really think about using both the quantitative and the qualitative? An example of this is how do physical injuries impact running performance and motivation over time? So if you would like, you can do it for yourself. You can write it in the chat. You can also come off mute and just share your thoughts. So I'll give you a couple minutes just to think about it. Also gives me a chance to drink water. So if you're just joining in, I can hear people popping in. We're just thinking of looking at this particular data set and seeing how we can come up with questions we would want to answer that would use both the quantitative pieces of this and the qualitative. We have one in the chat. Teresa says, what factors are associated with a fast pace? I love it. That'd be really good. I like that. We're just going to do like one more minute. I know it's a quick way of turning around and looking at this data, but want to be mindful of time too. It's also, if you don't come up with a question, it's always fun to see like what was your first thing you wanted to analyze. Some people will go navigate right quickly to the numbers that would feel comfortable. And some, I think one of my colleagues who's on here, Ellie, would probably grab to the running notes and go, oh, I could dive into this and figure out some good qualitative stuff. So just note where your preference is. Okay, so we're going to go ahead and continue just for the sake of time. And sorry, I'm shifting the slides a little backwards. So a couple of things that I pulled out from this is looking at this with a qualitative context to really explain a quantitative trend. This is one of classic ways to look at both of them together. I'm using a lot of the distance, the time, my constructive variable, and the average speed per mile, and the physical health. And what I'm seeing is that the runner maintained this really great pace, but had some slowing that occurred right at about the same time as it looks like a knee injury. So there may be something going on with physical condition affecting the speed. Something we wouldn't have gotten if we didn't look at them together. Another example is kind of integrating both together is looking at identifying patterns along with weather perception to determine preferred conditions for outdoor running versus indoor running. This can be really helpful if you're doing program development and implementation. So like a sensation program, you would actually get to be seeing like people's preferences in that qualitative data that might be really help tell you the story of what they need. So here, the runner seems to prefer an outdoor running in the 60s and finds that the 50s could be a little chilly and loves and really opts for running indoor when the temperature drops below 50. One of the other things you might note about this is the dates are kind of in the January, and these are temperatures, so they're probably not living in Colorado or at least the Denver area, because I've never seen those weather patterns unless so maybe California. So how do we apply these mixed data to tobacco work? So some of those examples that we were talking about integrating, here's some great ways to do it in the tobacco space. Using qualitative context to really do quantitative analysis. So an example of this is in the multiple housing smoke-free policy. The quantitative part could be we know that the percentage of multiple housing properties with smoke-free policies. But going into the qualitative part, we get to understand that the residents, quote, highlighting that the need for sensation resources in these MUH spaces. Another example is using quantitative data to support qualitative insights. So in this example, we're looking at vaping device disposals. We look at qualitative, we have interviews that reveal confusion on what is the proper disposal. And then if we dig into the quantitative work of knowing that we get data on the number of educational campaigns and resources for this area, we find out that they're low in the areas of the people being interviewed, giving us an actionable thing to address. Integrating qualitative and quantitative trends is another place. We can do secondhand smoke workplace policy. We can look at the TAB survey, or now the Colorado Health Survey, and show that there's 45% of community support going on with the smoke-free secondhand smoke policies. And with focus groups, though, we find another concern. There's over enforcement and unintended consequences. So you can kind of see a conflicting thing. There's support, but maybe there's some issues that we need to address. I told you I'd circle back to the grocery store. So the grocery store is really just more of this overall concept. These are not held in, uh, they're just more of a concept. Sorry. The list is really showing you that quantitative part. Maybe you're structured and you like the number base, and that really represents that a survey is showing that 60% of the residents in the multiple housing unit reported exposure to secondhand smoke. Maybe the browsing is more of like that qualitative side. We're experiencing, we're the contextual side of it. And this might be focusing that people are having a hard time really confronting their neighbors on the secondhand smoke exposure in the multiple housing units. And then a mixed approach is really integrating those two pieces of data. It's a mix going into with the list and browsing. It's that tobacco policy reports combined with the survey really show that you have 60% of the residents having the exposure with the quotes of the secondhand, the social challenge enforcement. Oops. So the key takeaways from this is that both types of data are very valuable. You really need to just choose the one that best fits what your research goals, your project is, and what you need for decision making. Integrating both is really helpful to kind of tell the story, but you can always use them separate. Practical application always is better over classification. I think right now mixed method is a high kind of hot button of everyone wanting to do, but it's really a matter of just being a way to integrate the two together to serve the purpose of what you need. So think data like a puzzle. Some pieces of the are numbers, that quantitative piece, some are stories, like qualitative pieces, and together they give you that full, rich piece of the picture. And with that, we would love your feedback. This will be available in the next section too, so it's the same survey, but please give us your feedback on how we're doing and what we can improve on, and other webinars you would actually love. And I would love to open it up for any questions and comments on this section. We will come back at about 1:30 to do our next section on dissemination of data, but I wanted to give space for people to talk. Yeah.